Brewis. Mr. Steingart.
Here.
Mrs. Labuda.
Yeah.
Okay, thank you all for coming. I just wanted to take a few minutes and talk about some of the reforms that have taken place in the division. I understand that there are some concerns about a focus on fraud, waste, and abuse, which actually, you know, at the fall committees at the state level, NISAC, that was something that was brought out on the state level to identify fraud, waste, and abuse, to deliver services better to the needy. So, a few months ago, I had put together a summary of reforms, Sullivan County and positive social service reforms, because I think some people don't understand the scope of positive reforms that have occurred over the last 2.5, 3 years. So I'd like to hand this out. I made copies. I don't know, there's probably not enough to go around, but if you want to review the summary of reforms, it is 2 pages. So when I pass it around, just take two, okay? And on the summary, you'll see, which was, was sent out in the media, and it was printed in the media for people to realize. If you look at prior to reforms, the amount of homeless people in area motels was an average of 250. They were intended to be temporary housing, but sometimes people were there for up to 1 to 2 years. And if you look after reforms, and this, these numbers are from a couple months ago because this was sent out to the media then, but at that point there were only 11 individuals and no families currently in area motels. Homeless are placed in managed housing, verified apartments of reputable vendors, or with their families, okay? If you look down a little bit more, we have, prior to reforms, over 60 children in out-of-county institutions. Currently now we have only approximately 14 children in out-of-county institutions, with remaining children in county closer to their families. And I can vouch for that as a foster mom and an adoptive mom. We adopted our little boy, he's 9 now, he was 7 when we got him, but from another county, who, you know, as the chair of the division, I felt that reforms needed to take place to keep the children closer to home in county, which is what our goal is. There are some children still in therapeutic homes, you know, for various reasons, but we've really made a positive change in that area as well. If you look a little further down, approximately 23 children in county foster homes, fewer children freed for adoption. I tried for 4 years to adopt through Sullivan County. And it didn't take me long to adopt from another county. Now, and then on the second page we have now approximately 100 children in foster care. 14 are freed for adoption. You'll see on this report today, it's actually 17. And that's a vast improvement in addressing the needs of kids to be in a safe environment. So anybody that has any concerns should look over the summary of reforms. We still have a long way to go. There has been challenges, but I'm gonna say it again. We're moving forward with reforms. We need to improve our staffing levels, which we're gonna talk about today, which is one of the discussions on the agenda. And you know, I just want to thank the staff over at you know, DFS, Health and Family Services, the Commissioner, Randy Parker. I want to thank Giselle is here today working with the homeless. Tremendous positive movement in reforms. And I have personal stories about people in motels, and I'm proud of the reforms that have taken place. So with that said, we're going to move into our reports. Division of Health and Family Services, Commissioner Parker.
As we do each month, we submitted a pretty lengthy written report, and probably the best way to start is to just take any questions that members from the legislature have.
I had a question about the New York Starts program. Maybe Joe can kind of explain that one. That's a new one to me.
It is a new program. The acronym is spelled out in there. I don't remember it off the top of my head.
It just says New York Start, and then districts. That's
District
with health
was what we
homes?
talked about the last time.
Right.
START is actually a new program that is funded through the Office of Persons with Developmental Disabilities. It's a program basically where there's a team that is trained in an evidence-based program that was began in, I believe, Massachusetts, and is now in several states, working with people with developmental disabilities of various ages, and their families or their caregivers for people who have behavioral issues. And when I say behavioral issues, it covers a wide range. It's not just somebody who has a developmental disability who may be acting what we would figure is inappropriate to their environmental issues. But it also may be a person with developmental disabilities who also has a mental illness. And this team of trained experts comes in, takes a look at the person's behaviors, and works with the families and caregivers to try to reduce those behaviors so that we can avoid hospitalization or avoid this person being put into a smaller institution-like setting. It's just started in 2 of the 4 regions in New York State. We are the 2nd region to start it up. I am serving on the steering committee to try to make sure that Sullivan County gets theirs. I'm looking forward to its full implementation. They are taking referrals. The 800 number is in the packet. And if anybody has any questions, please feel free to give my office a call, 292-8770. And you can call extension 2097. And we'll give you any further information with regard to that. DSRIP is an incentivized program, an incentive payment program that basically where the state government has partnered with the federal government to take about $8 billion over the next 5 years and be able to reorganize healthcare as we know it. Part of the initiative in DSRIP is to be able to have behavioral health services co-located, housed, or collaborating with core physical health services. The object of, or the goal is to, better integrate care so that we can avoid people being hospitalized repeatedly and unnecessarily. I'm also on a couple of DSRIP committees. There are 3 entities that have applications going into the state to be able to implement DSRIP over the next 5 years. Those are Refuah, the Westchester Medical Center, and Montefiore's Hudson Valley Cares district. There are a lot of moving parts to that airplane.
So it's a savings through the Medicare federal government.
Yeah, at
Is
this
it
point in
$8
time,
billion? $8 billion, right?
Over the next 5
And then the
years.
health homes will transition into health homes, and that's where Refuah and Mount Fiore come in?
Health homes are a part of the Medicaid reform. As we used to call it, it used to be, intensive case management, which was funded through Medicaid. It's now called care management. And care management is provided to those people. They're usually in the high spend category of Medicaid who have 2 or more chronic disabilities. And when I mean high spend, it means like these are people who've been hospitalized repeatedly over the last year or 2. And they've been identified through the Department of Health as being high spend people. They're provided with a care manager with the goal of looking at a care management plan that incorporates both their physical and behavioral health needs, and as well as their societal needs in terms of whether it's housing or other type of care services that would be able to help reduce the chances of that person being rehospitalized.
Is it mostly, more physical than mental, or?
Actually, the first referrals that we received, there were a lot of major physical chronic issues that we were seeing, but for the most part, the category that we're working with are people with chronic mental illness as well as some other chronicity like cardiac issues, or could be obesity, it could be high blood pressure, it could be Hep C, could be a number of different things that we would work with.
Is that also due because of the fact that a lot of the facilities are closing and they're looking to, have more of the mental, issues?
The health home initiative and the DSRIP initiative while paying attention to the next round of deinstitutionalization, really don't have anything to do with that. They really have to do with trying to reduce the state's overall Medicaid spend. There's another initiative for that.
So if the homes are located in Sullivan County,
A health home isn't necessarily a home. A health
like a
home
clinic, right?
is a series of services that are provided through collaboration. For example, we provide care management services to 2 health homes that are in our region. And what happens is that health home designates people to us to provide the care management services to. A health home has collaborators such as hospitals, primary care physicians, outpatient mental health clinics, and things like that, that all collaborate in providing services for that person's care management plan.
Can I ask a question?
public comment?
Yeah.
Yeah, we're gonna work through the agenda, and then we have public comment.
Okay, because my public comment has to do with the Health and Family Services.
Right, we'll get there.
Okay.
Lil, thank you. Okay, are there any other questions for Joe?
Well,
Cora?
just in general,
Mhm.
I'm still confused about the state takeover of Medicaid. I thought that meant that they were going to be administering it, and so I'm not really clear as to where we leave off and where the state takes over in terms of number of employees and services and
Right.
how that.
What comes to mind is like the
Transition.
PROS program, right? We transitioned out of the PROS. I'm not sure either.
Is it different for each program, or is there a general goal, or I'm not really clear.
Well, there are 2 types of state takeovers of Medicaid that we're looking at. One is we'd like them to just take over the payment of all Medicaid bills so that the counties can get out of that. That's an ISAC issue that we've been struggling with for a
And
little
that
bit.
means that we would still retain the 20 million cap?
That would go back into our general fund, I believe.
Okay.
If
But we're
the
not
state
sure.
actually took over. Well, we're pressing. The other state takeover is actually the administration as well as the application process of Medicaid, and that's really more of a Randy question.
Okay.
The state has, over the last few years talked about taking over that process.
So it's a staggered process, it's not uniform, it's not,
There-
like, at some
yeah,
point,
there are-
we're
there
gonna
are
be
several
able to say.
pieces moving at the same time, yeah.
Is the goal at the end of all of this that we no longer have county employees doing that work?
That's the state's goal,
Yeah.
is that the state would administer Medicaid at a statewide level rather than at a local level. And the thought and hope is, well, then take the local contribution with you too, but I don't necessarily see that happening in the near
The
future.
20 million?
Yeah.
22.
Because it went up to a little bit this year, right? Cora,
How
is
much?
that-
398.86.
How often?
Every week. Every Tuesday it goes out of our account.
So, what week was this? Every Tuesday comes out of our account, it's our money. We send it. And, if the state takes it over, then we don't get the money from the state, but we don't have to send it out? Does it end up being a
A lot.
wash?
Well, you have 9,000 to 10,000 people receiving Medicaid, right? So the 9,000 to 10,000 people receiving Medicaid, the $22 million is approximately 10%. That's the local share of that total Medicaid cost for Sullivan County. Now, up until the last year or so, Sullivan County DFS staff, Medicaid staff have authorized the applications, have recertified the applications, have done the interviews, etc. Right now, we're in a situation where new applications are supposed to go through the health exchange and through New York State. Within the division and at various locations in the division, there are healthcare navigators on site at community services, at public health, and within DFS, so that when folks are applying for health insurance and are Medicaid eligible now are being processed by the navigators. But there still is, with the state, when someone comes in and is applying for Medicaid and there's an emergency need, then we process that at the local level. And then different populations of Medicaid recipients, the state has done the recertifications. We have done other populations of the recertifications, but any changes that happen within the case are still being then sent back to a local level, and we're still doing the changes. So at some point though, we will see a day where we will not process Medicaid applications locally.
And
But
those-
we
so-
still will, there still is a local share of that total probably $250 million expense, which is Medicaid, and there's a local share to that $250 million expense.
But we reach a cap, whether we have 9,000 or 29,000 people, we only have to pay X.
Correct. Right now, that local share is capped.
Okay.
You know, and in years past, on an annual basis, you didn't know what your local share was going to be. And that was difficult for counties to budget on an annual basis, not knowing if you were gonna be 18 million or 20 million. Now that amount is capped.
Okay,
You know,
so-
the concern becomes, you know, will it truly stay capped?
Okay.
You know,
I know there's a hook here.
so we should all pay attention to that. If, you know, with that cap, if that capped amount continues to be, you know, the same on an annual basis, or if there's discussion about, you know, increasing that. Because with the Affordable Care Act, and you'll see in the statistics, you know, the continued monthly increase of Medicaid eligible individuals in Sullivan County.
So the cap potentially will go away, potentially.
It hasn't yet.
But
It
it
hasn't.
changes to the navigator system. And the
No, no,
navigator
no,
version.
no.
One doesn't have anything to do with the other. The navigators are just basically places where people can apply for insurance, and if they are Medicaid eligible, they would then be pushed into the Medicaid program. If they're not Medicaid eligible, there are several different insurance products. Now I sound like an insurance salesman. There are several different insurance products that may be able to meet their needs at a reasonable price for somebody who has limited income. So that's where that comes in. The actual Medicaid spend is based upon the people who are covered under Medicaid, who are assigned to Sullivan County because they're Sullivan County residents, and the services that they use. So there's a difference there. My suggestion, and Randy is correct in terms of looking at, you know, the Medicaid cap, and you know, at the very least we want to maintain a cap. You know, but NISAC is trying to push for a complete takeover of the Medicaid dollar in the state, which, by the way, may be why the state is putting DSRIP and health homes and all these other things together, because they've already created, according to the Governor's Accounting Bureau, a $14 billion savings in the 4 years that he's been governor.
And who pays the wage for
Well,
the navigator?
The wage of the navigators is done through state funding. There's a grant that is available, people could apply to. The navigators in our area are Fidelis and the Maternal Infant Service Network. You know, and they have people who actually come to our office and are there for, you know, a couple of days a week.
So they're not county employees?
No, they are
No,
not.
they're not.
Okay. Thank you.
Cora, did that answer your
Well,
question?
I guess the, you know, long story short is, has that led to a need for a reduction in county employees in the Medicaid
We
system
have
like other counties?
in our Medicaid unit, I mean, going back to, you know, 2 years ago, we have, you know, through attrition, reduced staff in Medicaid. So that one day we don't all wake up and say, well, you know, we have all these staff, but we're no longer performing the function. So we have moved people to SNAP. You know, you'll see the numbers in SNAP, or formerly known as food stamps, increase quite a bit. We have moved staff to temporary assistance, child care, HEAP. so we didn't get in a layoff situation, when we eventually no longer provide the Medicaid administration locally.
Okay, that's the answer to my question.
And then as far as the local share, I mean, New York is one of 2 states in the country that there is that local component to Medicaid.
I heard North
North
Carolina was
Carolina,
moving away
yeah.
from it.
So we're the only two, North Carolina and us.
Follow.
Okay, thank you.
A quick comment, find a better word than collaborator or collaboration. I have a very bad feeling when I hear those 2 words.
I'd be willing to go to your thesaurus.
Just saying. I don't like the word collaborator. It
Okay,
brings up a bad connotation.
We're gonna have the Adult Care Center update from Shanoy Wellington. Shanoy, did you wanna sit up here?
Probably not, but she's gonna.
Good morning. So for the Adult Care Center, we've seen a transition where our supervising social service worker had handed in her resignation. She actually retired. We are actively seeking a replacement for her. And we have put our marketing personnel in full gear. She actually did a few things last month, or for the month of October. Rather. We created brochures. I think we had a brochure a long time ago, but we just revived that, and we actually created a new brochure, which actually is being distributed as we speak. We participate in several outreach activities. We did the Alzheimer's Walk in Montgomery. We also did interviews with Channel 6. We also put advertisements spread in various local papers, The Democrat, The Reporter, Catskill Shopper, in the senior health and senior living sections. We also had a representative at the Monticello open house with the Office of the Agent, and actually it's the Monticello Senior Safety Day, sorry. And we also did marketing visits to public nursing, Office of the Agent, several pharmacies, and local medical offices. I had done an analysis of how we needed to go about our marketing plan for the ACC, and we realized during that analysis that the facility is not really known or recognized county-wide, especially in the western end of the county. So what we started doing, we started getting our name out there. There was a name recognition. Some people don't even knew where the facility was located. So it's getting them to kind of see where we are located. And as a result, we have seen increase of our marketing efforts. We have seen increase in our census.
So are you tracking how they found out about it?
Yes, we are tracking how they found out about us, and we have made some discovery which we about how they knew about us or not know about us. So we are actually working with our local hospitals. We have met with some of them, and have scheduled meetings with the others to try to see if we could network.
Do you know if the advertisement brought in any increase?
Absolutely. I think when I started back in September, our census was about 79%. So as of today's date, we are up to 86%.
Thank you.
Wow, that's good.
And we also got new plans for our lobby area. We are trying to appeal to the home-like environment at ACC. So we are trying to definitely give the facility a home-like feel. So I am actually doing a little bit of restructuring internally to make that possible.
So, since October, at 79%, in like 6 weeks, it's up to 86?
Yes.
Wow.
Mm-hmm.
So you really geared up with your marketing about then, right?
We geared up, definitely geared up with our marketing and how we respond to admission, responding to admission process. Basically, we get PRIs from the hospitals, and there was a delay in response, so we have definitely shortened the response time in how we respond to PRI coming in from the hospitals.
I know you and I had a brief conversation about the link with the Catskill Regional and some of the,
Right.
local facilities, so, is there a priority now for them to recognize the facility?
Yes.
Okay, that's excellent.
And
Kitty?
Are you, working on short-term stays more than long-term stays?
We are. Actually, what I've done in recent weeks is to try, we had a few people, individuals who were on the short-term rehab, but they were really long-term residents. I've tried to move them from the short-term rehab and get them over into the long-term area so that we can focus on getting the short-term rehab unit to function as it should, as a revolving door.
Okay, and with that in mind, you have occupational therapy. It looks like from September to October, your numbers went up, but in your physical therapy, which would be the broken hip, those numbers have gone down. Can you help me better understand why that is?
Well, for the month of October, few of our residents who actually came in for physical therapy actually went out to the hospital. There was the hospitalization that, so of course, being out, we could not provide services to them, so that impacted our physical therapy
Do you have a
service.
full-time physical therapist there?
We do.
And that person is, my mind says if I need my knee replacement, physical therapy, my hip, my whatever, I want therapy once or twice a day, at least 4 or 5 times a week. Is that how you operate this division?
Therapy is determined by a few things. It's determined by how they're assessed. It's also determined by the payer source. Some payer source will, depends on what the diagnosis is, the payer source will determine how many units of rehab a person is given per week.
So what's the average for a replacement, joint replacement?
I would believe that they could get up to 5 days a week. I'm thinking 3 units, which is about, each day 50-minute section is equal to 1 unit, so about 45 minutes per day, I would say.
So then I'm really, so your number went down in October in physical therapy because the people were admitted for short-term therapy and then they
Ended up in
went
the
back to the
hospital.
hospital?
So that reduced the amount of individuals who had actual hip replacement. And then you have to also take into consideration, individuals can refuse therapy, which they have done. You know, if they refuse, if let's say one day they wake up, they don't feel like they want to participate in therapy and they refuse, we cannot force them to have therapy.
Okay, and they're being readmitted to the hospital because?
Changing their status, changing their health status.
I understand that as a nurse, I know what the
Oh, okay.
reasons are.
Mhm.
Okay, but as a nurse, I'm wondering, why they're going back to the hospital and not having IV therapy, antibiotics, whatever, for their short-term stay in your facility rather than being transferred back to a nursing home for that. Is it that kind of care or is there something else going on?
Sometimes there's other things going on with them, but they, to answer your question, we do try to, because there is an initiative to reduce hospitalization or re-hospitalization, so we do try to do everything that we can for that person to stabilize them. If in fact we do believe that we cannot stabilize them, we do send them out.
So you do IV therapy?
We do IV therapy, correct.
Okay, so you are doing IV therapy?
Yes.
Okay. I didn't realize that
Thank
in-house.
you.
Okay,
Quick comment.
Jean?
I'm glad to see that your revenues are above budget and your expenses are below budget. Thank you.
Thank you.
For a lighter moment, my little adopted son drew my self-portrait for me.
He gave you a haircut?
It was stuck in my, you like that, everybody? My hair's not long enough. I'm sorry, I just had to share. Josh said he has the same job. Okay.
That doesn't mean they're looking to send you to the job.
No, it's not gray. It's not gray, Ira.
I just wanted to know the timing of announcing that.
Okay, thank you. Okay, we're gonna talk about welfare to work transition. We had been working to transition welfare to work to Liberty, to integrate, and I will have Commissioner Parker explain where we are with that.
I'll open it up and I'll turn it over to Giselle, the expert, but, I mean, historically, we have had a contract with the Center for Workforce Development, the department has with planning and the Center for Workforce Development. Within that contract, there were 5 county employees that had worked at the One Stop on behalf of our clients. What we are doing is, in 2015, is that contract is coming to an end. We are transitioning 3 of the staff from the Center for Workforce Development to within our department. Again, there were 2 vacancies in that department that were not filled, but we are going to pick up the operation of the program, you know, with 3 of the former employees from CWD. They'll become DFS employees as of January 1st. If all things go well with the budget, that is all covered in the budget. We are in the process of, and I'll turn it over to Giselle to talk about what's been happening to make this transition possible.
Before you turn it over, if I could ask a
Okay.
question. My concern is, and I'm very glad it's happening, I want to preface it with that. But I know how employees oftentimes are, so if
There's only
it's a
2
civil
months left.
service move, do they change their status, and is there pushback regarding that? Because they're all government employees anyways, right?
So then you asked if there was pushback with government employees?
Well, no, if because they're moving from where they are into public health.
I mean, they're the same.
Their title and
They're
stuff?
the same title.
Okay, all right.
All of their employment status will.
But they're not moving to public health.
No, but they're.
Moving to DFS.
Moving
Right,
to
I'm
DFS.
sorry.
Okay,
Well,
Kathy,
sorry.
wait, just let Kitty finish, Kathy's next.
Do you think it's dysfunctional now, the way it's working here, and that's why you're moving staff up there, or so what would be the?
I think it's.
Excuse me,
I
I'm
think
asking
it's-
him a question.
I think it's been fractured. You know, I think what we have tried to do in the 2 years I've been with the department is focus on the front end of the agency and at the application process. And what we have not been able to really integrate into that process is the employability and the preparation of getting people ready. I mean, we're able to do it now in that we accept the application, we determine if they're employable or not. Some folks go to community services for various assessments, et cetera. If there are substance abuse issues, alcoholism, et cetera, that may affect employability. But we just felt the need to have that service on site, rather than setting up an orientation, possibly a week later, 2 weeks later, and having the folks then go to Monticello. So we really did it to just integrate that all into the campus and Liberty.
And I think I had gotten a number of calls from people that were unable, for whatever reason, to keep that appointment. You come to Liberty and then you have to make an appointment, sometimes 2 weeks later. Transportation might be a problem, they miss the appointment, you know, for whatever reason. So that was part of the discussion as well. How do other counties handle the welfare to work piece? And, you know, the transition to Liberty inside a fiscal presence seemed to, you know, help all the way around.
And it still is, the folks come and have met very hard times, and we want to be able to provide that emergency assistance. What we do not want to become is a way of life for individuals in collecting forms of public assistance. So we, in terms of coming in, you're unemployed or you have not been employed, you may or may not have employment skills, et cetera. We really want to just, you know, get that whole team approach in terms of getting services to that individual, so they are no longer reliant upon public assistance or temporary assistance. You know, we want to focus on whether they need GED, whether they need high school diploma, whether they can attend any, you know, post-secondary education, get them basic job readiness, training, interviewing, all of those skills, and we want to focus on that as part of the department. We don't wanna be seen necessarily as this is where you come to get welfare, and this is where you go to, get a job. We want people to come in to see us as the place where you go to, I may need temporary assistance, but you're also gonna help me get on my own 2 feet and be self-supported.
Oh, so none of that's being done now, they don't work?
It's bifurcated, it's separate, it's not integrated. Could you continue it the way it is? Perhaps.
I have an old saying, if it's not broke, don't fix it, but obviously you think it's broken,
I've
correct?
gotten numerous calls
Broken
from
for
people that
years.
have that problem, that disconnect, that 2-week appointment was a problem for a lot of people.
Maybe
Does
Giselle
that
can
make
answer
sense?
a lot of those questions.
Wait, Cora had a question?
Well, yeah, if you can incorporate it into your report, I think one of the concerns that I had when we had various presentations from the Center for Workforce Development is that they're very activity oriented. And if you tick the boxes of all the activities that have been performed, you've done what the state requires. But what I've noticed from other counties like Delaware and Ulster, when we went to Delaware County, saw their program, and then what I read in the paper, Ulster has a new welfare to work program that they're trying out, is that they actually have jobs at the end of it, not just a whole list of activities. So if you could address that concern, that'd be great.
Well, part of our transition over, just to start from the beginning, is our space. We are taking over space in community services. So we've gone up there, we've talked to Joe, we've gone up with DPW, and we've outlined what space we'll need as far as being able to have space for the orientation and assessment, resource room, waiting room, individual offices where people will be. So we've done that, and we're in the process of, that's the space that they will have on the Liberty campus for the employment unit. So it won't be at the Liberty location, it'll just be up there. And we are in the process of that. Also with MIS, what equipment we'll need as far as setting up a computer lab, faxes, and all that equipment. So those are 2 other logistical things we've been working on. Identified the personnel that's coming over. Again, that's a supervisor and 2 of the employment specialists. Our program right now, they do the orientation and assessment as required. Resources are available through the one-stop. That's the computers, fax, and anything that anyone needs. And there's no job development. That's the piece that we want to. When I was doing the employment plan, which is required, I worked with CWD, and somewhere along the line, we lost the job development piece. And, they had said that that's just not something that they do. So our goal, one of the biggest goals when we start a program, is really doing the job development piece and getting out there and coordinating with the one-stop, because when we went to Huga and when we've also visited other places, there's a greater coordination with the one-stop. Job fairs, having employers on site. If there's a new employer coming to town, they do open houses. So it seems like historically our population hasn't been involved in that for whatever reason. Our initial program is going to be continuing a lot of what's done, the orientation and assessment that's mandated, having resources available to people. But instead of just doing the job work activities, we have a lot of people coming in that don't even have the basic work readiness skills. Our employment work experience program individuals, they're called CWEPs, very limited. It's hard for us to get, people. We're identifying what we need. At one point, DFS, I think when I started, had 6 CWEPs, but there was nothing for them to do. There weren't any projects. It wasn't defined. We've had a hard time getting individuals that can be work experience individuals because of the lack of basic skills that they have. So we want to build that program, and that's something that we've tried to work with now. That it's really been hard to coordinate. Job clubs was something that a lot of other districts are doing that we don't do, and that's mandating, once or twice a week a person comes and they learn how to look for a job, where are the jobs, how do I interview, how do I dress for success, all those other things. And then I know United Way has a program with the Dress for Success. So it's the coordination of everything, getting the resources that they need because we have the assumption that people are coming and that they should be working, but a lot of people have not worked. And then there's no bridging of that gap. It's like, well, you don't have the skills to work, so you get put on the back burner, and we're gonna work with people that are coming to us because they're temporarily in need, and we're not addressing the generational, you know, where the person just doesn't have the skills. So we wanna do that. We're hoping to incorporate some, since we're only getting 3, we're hoping to use some of our examiners that have been working with the eligibility call-ins and that are aware of the program to supplement. And there are a couple that are very good with employment so that they can help with like work readiness skills, and we can do modules and classes. One of the things with Cayuga's Job Club is it was like a 7-week program, and you came once a week and you learned a different module, like how to write a resume, how to interview questions. There was mock interviewing, just a lot more of those kinds of activities if you're doing them where it's group orientated, and we can actually, you'll have a skill that then develops the staff that we're putting out there in the community. And just really coordinating more with employers. I mean, I talked to Randy about we need to be at the chamber breakfast, we need to be with businesses so that they know, like, you know, and understand that we're gonna give them qualified individuals. So, I mean, it's not an easy task because it's really a lot of staff development that we're gonna be focusing on. But also coordinating with resources. When we did our eligibility call-ins and we had a lot of the medical call-ins, there were people that were limited due to medical, but they're not hooked up with Access VR, which is formerly vested. It's the, under the State Education Department, Adult Career and Continuing Education Department that helps people with job coaches and just all these other things to help them work. And that's kind of what my background was before this. So just that whole population that doesn't get to work because they're medically limited. And they actually, during our call-in, some of them did say, you know, I would work if I could find something a couple of days a week. So, I mean, it's just greater coordination. We're gonna have, I think the majority of the same staff. It's just gonna be a different way of doing these things, and then hopefully supplementing with, examiners and seeing how we can build in job developers or eventually grow the program so that we're kind of bringing everything together from the community, from TA staff, temporary assistant staff. The SNAP is going to have work requirements by the end of the year, and that's gonna be new. There wasn't any work requirements for food stamps, so it's gonna be just kind of bringing it all together, and then if we have a problem, everybody that is involved is there.
The other part is transportation, because that was what we noticed
Transportation, yeah,
in Delaware County, is that, if people had to literally have a job in Ulster or, you know, outside of the immediate area, given our geographic proportions, a lot of people would work if they could have reliable transportation.
And we still are maintaining that contract with Rolling V for the welfare to work population.
Okay, any other
Sounds great.
questions?
I just wanna compliment you on what you're hoping to achieve. It sounds fantastic.
Thank you, Keith. Okay, we're gonna go, we have one resolution, Department of Family Services, to authorize the county manager to enter into a contract between Sullivan County Department of Family Services and Dr. Eileen Tracy. Motion to discuss? Jonathan, Kitty? Any questions?
From what I'm seeing, it looks like it's covered in the budget, and it is not a big issue for our finances as far as the county. It is budgeted, correct on that?
Right, Randy, you wanna comment on that? It's a 3,500 county share.
All in favor?
I'm not on the committee, I
Okay.
can't vote on that.
Okay, all in favor? Any opposed?
5-0.
Thank you. Okay, discussions, division staff positions, will come up later on in the Special Management and Budget Committee. For the division itself, and I'll have the commissioner comment on that. There was a request for, filling some vacancies as well as 10 new positions.
Well, we have we have authorization to fill any vacancy that we have right now, within the this is just the Department of Family Services. You know, there are a couple of vacancies right now in the account clerk series, the examiner series. I think Vicky just filled her caseworker vacancies that she has. But what we did propose in the 2015 budget was the creation of, I believe, 10 new positions in the department and the upgrading of 2 positions to assist in supervising different programs. I mean, so that discussion, I would imagine, will occur in the 11 o'clock special meeting in terms of where that funding would come from. In the budget that we presented to Office of Management and Budget, we did budget for those new positions. Our budget in general for the department did go up from 2014 to 2015, but we attribute that increase to the intergovernmental fund transfer for the adult care center, and that amount always has come from the Department of Family Services budget. So, I mean, the preview of the positions, it's positions such as the housing inspector that DFS has had in the past to go inspect places that are vendors, potential vendors, where we're paying for individuals' families to live. We have additional caseworkers in there. We have 1 additional employment staff member, and again, CWD did have 5 people. We are starting this back up with 3. And there is I have a list of the positions I have. If people want to see them now, or if we want to carry the discussion over to them.
Well, I think for me, I was aware of some of the union concerns about training and some quality, assurance programs. And I believe that some of these positions were to address some of those issues. And the 10 new positions, if I'm correct, would be reimbursable up to about $140,000, which.
The local cost of the positions that we put in the budget is $140,000.
So for 10 positions, which could be realized through a reduction in your budget.
And again, not to, in terms of committee, what committee to talk about it, we believe that we submitted a budget to Office of Management and Budget, and then Management and Budget submits it to the Legislature. The budget that we submitted to Management and Budget differs from what was submitted to the Legislature. We would just, where we would like to see funds reinstated from what we submitted was with regard to the vacant positions. And we believe that we can meet that number, that final number, budget number that was submitted to the Legislature by a reduction in the safety net program. We believe that the local $140,000 cost, we can meet that in the safety net with a safety net reduction based on our expenditures in the safety net area in 2014. Whereas we had possibly, I believe, 3.6 or 3.8 million budgeted. Our expenditures to date for the 11 months, I believe, are 2.9 million. And we do not see those expenditures rising anymore in 15. If anything, we see them continuing to decrease in the safety net.
When I reviewed the positions, the titles of the positions, and received concerns from employees about some of the issues over there with staffing, it seemed to address some of those issues, union concerns, as well as you have some chief social welfare examiners and several of those.
Going back to 2008, the department had 225 employees in 5 or 6 years ago. At the current time, we're at 158. I don't know the exact number of employees. That includes seasonal heat workers. So we're still, and the workload has not decreased or diminished.
Right.
So for years, you have had you know, all staff in that building, some people doing 2 and 3 jobs because of previous reductions that were made.
And I have had staff reach out to me, and so, I'd like to continue this discussion in the special management and budget at 11, but are there any questions about that?
Cindy,
Cora?
I don't think anybody's had time to really, you know, absorb the recommendations that came out of the Rick Ryan report. But there's no way that any of those recommendations can be followed without people doing those recommendations, which means bodies. So, you know, there has to be an
correct some of the
analysis.
errors and like that, yeah.
Well, there
exactly.
has to be an analysis of, you know, in order to, why did we spend all that money on that investigation and then we don't follow through on the recommendations?
Right. Okay,
Discuss at 11.
Kathy, did you have a
No,
question?
so if you're gonna discuss at 11, that's fine.
Okay.
Getting behind.
Number 2, division versus state training. This discussion is to address, also like Legislator Edwards says, some of the recommendations out of the investigation about trainings within the division, and we're starting to implement those. So, Commissioner Parker, if you would comment on some of those trainings. And I think one of these positions was an assistant employee and training director.
No, in all honesty, I do not know what the recommendations are from the investigation.
Right.
Okay?
Well, can you comment on the
So what you don't know.
current trainings? Yeah, what you don't know.
We'll let you know the rest.
Because we don't know it all yet either.
We'll know it soon.
I mean, as far as training needs, and I think we talked about it, you know, we had a recent, without getting into great detail, you know, in the Child Protective Department, you are a senior caseworker in the Child Protective Department. Before the, you know, state of Department of Children and Family Services allows me to assign a case to a caseworker, you have to go through state prescribed core training, all right, to be a child protective investigator. You know, to be any type of caseworker within the department, you have to go to a basic core training, but child protective is additional training. You will see in someone's initial probationary period, which is anywhere from 8 to 26 weeks, you will see someone who will possibly have 4 weeks of training to become a caseworker. Where it becomes tricky and difficult is we're at the state's discretion in terms of when the training is offered. If I have a new child protective caseworker, you know, I hope that there is a training in somewhere in New York State that I can plug that caseworker into. I mean, the state is pretty good about how often they offer the Child Protective Training Institute, but you have to, you know, so there are situations where you may have a worker who comes on board that the first training is not available, does not start for maybe 4 weeks into their job.
So how can we correct that?
Can,
I
the
mean,
state
you
controls
can-
Is there something
Some
inside that can be?
states are, you know, we are state supervised county administered, right? One way to fix it is for the state to employ the child protective in the foster care and all, and be state, you know, administered, and to just be state administered.
Are there any
Again,
counties that do that?
I mean,
believe
it's the
so.
state, it's
It's
the
the
new
state.
way.
It's a state mandate.
You know,
Are there
if you go
trainings?
to like Oregon, the state of Oregon as an example, right? The state provides, they cut the county level out in terms of providing the services, and they provide, their state employees providing the service.
Is
I'm
there-
sure there's more training available, but it is, what happens to us sometimes is, and it's not, you know, we don't necessarily question it for the sake of questioning it, but the county's vacancy policy, right? When I have someone who, a budgeted position, and that individual resigns from that position, I'll always lose a month in being able to fill that position because I have to wait till the next executive committee meeting. So that provides a little barrier to me in terms of when I can bring someone in and possibly when a training is coming up. If I can instantly fill a position when it becomes vacant, that knocks that barrier down. That last quarter hiring freeze is a barrier if, in terms of lining people up, having people on board, getting the training, getting them plugged into training. So throughout the year, obviously if there's not a training available for X period of time, I'm not gonna bring someone on board right away because I'm gonna bring them on board and then they're gonna be untrained. There are things that we do while we're waiting for trainings to become available to orient them to the agency, to shadow their colleagues. Although they cannot be assigned primary status, we can have them do what they would call collateral work towards an investigation. But, again, when it came on board, we have those 3 child protective indicators. New York State sends a report out every month, right? Sullivan County, we were in the bottom 5 counties in terms of the number of workers we had and the number of investigations they conducted. And, in the last report that we saw, we are now in the middle of the pack in the state, which is impressive.
That's
it's good.
Yeah.
What helped us tremendously last year was the legislature approving the 3 additional child protective caseworkers. But by the time that was approved in the new budget of 14, but they were not on board and trained. Really, I think the last one was in August. So, it's complicated. But anything that you can do and help us in filling positions such as that will help us in getting people
So
trained.
just so that I
quicker.
understand, there are state trainings and they occur throughout the calendar year.
Yes.
And in between that, are there in-house trainings, maybe through web programs or, having a presentation from a state staff workers or, something?
In the past, we had a staff development coordinator. We have not had.
And
a
is that the
staff development.
position that I
That
see
isn't-
was
that isn't.
defunded?
No,
No.
that's in the budget.
Okay.
Is that gonna cover also, it's not just new people that need to be trained, but I remember
Ongoing,
hearing that,
right.
it was like a building of 250 independent consultants over there.
Here's
So-
an example of a training that we were fortunate that we have worked with New York State Office of Temporary Disability. They are coming and bringing trainers on site to Sullivan County for a 5-day training on the employment program.
They never did it before?
We haven't had it on site
So
before.
when did they start that?
When is it?
They're coming Monday.
Monday. So it's.
This is for the new program, right?
Well, this is we are having our examiners participate in the training, supervisors participate in the training, and we have asked for the employees for Center for Workforce Development to come and participate in that training.
So it's for
The last time
existing, not just
that
new.
training, that people from Sullivan, we're talking like 10 or 12 years ago.
Vast improvement, I don't
So
know.
that's on site, otherwise we would have had to send people to Syracuse or Albany. We brought the training here, I think even other counties are coming to it. So as we work on our relationships with state agencies, bringing whatever training on site, we are going to do that. And we're
Okay,
just
that's
not
good.
big enough necessarily to be a host location for like Child Protective Corps. They tend to go to a more centralized area.
And just one more thing, if we're talking about, staff inside DFS, where, they have the, frontline applications coming in, and, I've gotten some concerns from employees, I don't wanna make an error. How is that being addressed, that piece? Would that cover it, that training?
In the employment area, in the temporary assistance area, there are different state program reviews that are done. Our SNAP program had a programmatic review. Once you get that programmatic review back, Giselle works with Kevin Bennett and the examiners. There was one issue in particular in the SNAP that, in 33 cases reviewed, it was a problem in 32. So you know that that's a training issue. You orient the staff on that.
So when are we
Boom.
doing that, is that happening?
It happens,
That
even.
happened already, we're waiting for the report. They said the report takes about a couple months for
Okay, so
them to
those
generate.
employees have been, trained, and now you're gonna look at, cases to see if that number improved, is that what I understand?
We had the management evaluation come in, so they came in, they pulled the cases, and they did, and now we're waiting for the report from OTDA. That will, just preliminarily, they told us what they saw across all the cases was this one expedited screening sheet that
So
was.
then you can concentrate on the areas that need improvement through training?
And technical assistance.
Well, and I've been working with, a couple people in the SNAP unit, that have given me like a training guide how to open, close a case. They put together like a little folder that would be helpful. We're reviewing that to try and put a manual together to address, because our training is similar to the CPS with the whole core, but we, it's not like mandated, we try to get people into the core training, but they can actually be working on cases. The problem is it's so much information and so extensive that to have them shadow somebody and then try to work, it's very difficult for them. We understand that that's a need. So we had the SNAP management evaluation. We had asked them if they would come in and do this for us. They did it. That's with food stamps. They've identified some of the issues. They haven't put it in a formal report, but they did identify preliminarily that there was, everyone's missing this sheet. So that's probably something you want to address. So we're putting together, I'm in the process now of working with a couple people from TA and a couple people from SNAP, the examiners and senior examiners, to put together like manual or training guide that people can refer to if you're a new employee before you go to core. And it's everything in place, because we have really strong supervisors that have excellent training, and then we have other supervisors that don't, which leads us to, like, we need a supervisory training as well, which I'm also trying to work on putting together a curriculum, dealing with things like how to counsel someone, conflict resolution, those kinds of things, because it always seems to escalate to you're gonna get written up, and it shouldn't really be. It should be more of a process, and we just haven't had that. So, training guides we're trying to put together. I already have the information, so we're reviewing it, and then we could put together these guides, and it would be all the supervisors, this is a guide that we would want you to use when you bring in somebody new, so that everybody's on the same page. And checklist is another thing that we have. It's a process of, we were waiting for the SNAP program report to come back so we can make sure we've included things. But we do have probably 90% of a checklist for SNAP and TA cases in place that would go with the case. So when a signer is reviewing it, they'll actually look, and if they don't have something checked off, then that case can't be approved, and hopefully that'll deal with our errors and things, anything like that that exists.
But employees at rest, and so that's a process right now that's currently being.
Yeah, and there are several employees that have been involved in it, because we've kind of reached out to them and like, what do you see? What are the needs? How can we do this? I think for our units, it's instituting not trainings, but just meetings, whether they be monthly or quarterly, that where we can address all the different issues. So it's really, it's just a work in progress, because it just hasn't been done. So it's trying to pull it all together.
Okay, and we have great workers over there. I've had.
No, they are. They really pulled together, and a lot of the feedback came from the call-ins that group did, and a lot of if we were to do this, I think it would reduce. So it's also not us just like saying, well, this is how we're going to do it. It's getting feedback from the people that have been doing it and what would be helpful. It just takes time.
Thank you. Okay, if there's no further questions, was Lesha here, Youth Bureau? Karen or Debbie, anything?
I just
Nancy?
wanted to
Debbie.
mention, Joy mentioned Senior Safety Day that we held in October, along with our public hearing, and we had 102 people in attendance. Our numbers are increasing every year. We always emphasize the public hearing, and we got some positive comments out of it. So.
Excellent. That's a good number. Karen?
No.
RSVP?
Good.
Good to go. Nancy?
We had an open house yesterday for the 40th birthday of WIC, the WIC program, which started in 1974, and we've been running the WIC program since it started in Sullivan County. We are submitting an application which is due next week, I believe, or the week after, for a new 5-year grant cycle to support the grant funding for the WIC program. It is open competitive. We don't know if there's any other applicants to run the program, but we're submitting it. And I did want to mention that we had a state site visit for the program, and we had phenomenal review of what we're doing. We're increasing caseload, and our Hispanic families have increased. The number of Hispanic families we're serving is about 30% of caseload. So compared to the demographics in the county, which is about maybe around 18% Hispanic families, that's pretty high.
That's a
So,
100% federally funded program.
yes, it is.
And how many clinics currently? Because I know there was
Currently
one
running-
in Livingston Manor that you were.
Yeah, we closed the one in Livingston
Mhm.
Manor due to a drop in enrollment.
Mhm.
We're currently running, I believe, 6 sites.
Okay. Okay, excellent. Any questions?
Good luck with the grant.
Okay, we're open to public comment.
Okay, I have 2 comments.
Lillian Stetner.
Yes. I don't know if all of you know that I'm a licensed clinical social worker, but I am. And I'm going to read the letter that Priscilla Bassett wrote to you, Cindy, out loud. And then I'm going to make a comment about domestic violence, okay? Which I didn't hear even touched here today. I volunteered for them for 12 years, so I almost like a staff person, am I not? Okay. It says, Dear Cindy, I am addressing this to you as chairperson of the Health and Family Service Committee, and I hope and intend that it will be shared with the entire committee at the December 4th meeting. I am unable to attend. For several months, I have been concerned about tone of these meetings concerning as they have on the fraud being uncovered. Although fraud exposure is worthy and necessary goal, I'm deeply troubled by the overemphasis, so am I, by the way. We should not allow this issue to distract from the overreaching goal of providing needed services to deserving county residents. As we all know, there is tremendous need in our county and not enough resources to meet it. The first assumption should not be that people applying for services are immediately suspect of perpetrating a fraud. The undesired effect could be to discourage worthy applicants from seeking help to which they are entitled and that we wish to provide them. People applying for social services can already be in a vulnerable state, and the assumption that they are attempting to obtain services for which they are not qualified may deter them from applying. We all want the money to go where it is intended, but we have heard many reports, anecdotal but convincing, that demonstrate the chilling effect that this aggressive enforcement has caused. What I am asking is, what are the department and legislators doing to overcome the chilling effect and the assured application that their requests are met with compassion? Why not emphasize the help that is given to those who qualify for federal, state, and county support in these difficult times? HEAP and SNAP, food stamps, and WIC, nutrition support for children and mothers. Relief of homelessness that would just amount to space on a cousin's couch. We would be proud that our taxes go to protect the vulnerable among us. Thank you, Priscilla Bassett. I also have an issue with family services in the point with domestic violence with victims. In the past, social services and Safe Passage have worked together and have really accomplished a lot of help for victims. In today's world, the victims are being victimized by social services. They are, when they go and apply, by the way, we don't do things for them. We help them get the skills to go do it for themselves, because the abuser has not allowed them to do anything for years, okay? So we encourage the victims to get the strength to go to social services. And some workers do go with clients, but we encourage them to do it. What's been happening now is they have found apartments, they have talked to the landlord, everything was fine, they go to social services and they go, okay, we need some backing because by the way, if a victim starts working while they're in the safe house, all support from the state stops and the victim has to pay for their living, okay? So we tried to get them to get their apartment so they can settle in and then go to work. These women are capable of working and supporting themselves. They're not asking for lifelong support. They're just asking for support to be able to take care of themselves. And yes, women get shipped all over. Sullivan County residents get shipped over to Pennsylvania, to Ohio. Ohio people get shipped over to Sullivan County. So it's not like we choose Sullivan County to come here. No, it's the state does that for the safety of the women. The country does that for the safety of the women. So yes, we do have. And we've had women lately who have gotten their apartment, they go to social services, and as Mr. Parker said, some workers are doing 3-4 jobs. So when it comes to getting the necessary paperwork done for the women to get their apartment, oh well, you know, gee, I'm too busy, I can't do it. They don't do it. The contract expires, the women have to start looking for another apartment. That prevents them from starting to work, which means it prevents them from paying taxes, okay? And they're continuing to be in the safe house. How good is that? And yesterday, we had a young man who has been abused by his mother. The mother was thrown out of social services. I'm sure some of you realize that. So came, filled out the paperwork. He was a victim. He is a victim. Donna got him a bus ticket to go to Pennsylvania to get away from his mother and brother. Social services did not want to give him a night in a hotel. Okay, because it was later at night, it was later in the afternoon. They couldn't get a bus to get him to Pennsylvania. Donna had to sign a page, which I think is totally illegal, but who am I?
We'll get to that.
That Donna would no longer give him any services, okay? And he had to sign that he would not require any more services. I really would like, Mr. Parker, to have a meeting with you, with the director of Past Safe Patches and myself, and talk about this. Because for years, the women were helped. Safe passage, domestic violence was a priority. It wasn't, you know, oh, you're just looking for help and you're being, what is fraud? No, they're not fraudulent. They're real people. When we interview these people, when we do the screenings, by the way, I do screenings on Monday nights, they're real. If they're not real, we make sure that everybody knows. But that's very rare. Most of the time, they're real. And Safe Passage is really, really, the women are not getting the services that they should. Thank you.
Okay, I'm familiar with Safe Passage, and I would be more than willing to set that meeting up. I think it would be a good discussion. So I will follow up on that. And I also want to comment, Priscilla Bassett, lovely, I love Priscilla. I sent her a long letter last night. I sent her the reforms that I handed out today in committee, and I offered to meet with Priscilla. So as soon as we communicate and have a discussion, I'll update on that in next month's meeting. Okay. Any other public comment?
Yes.
Star?
A quick comment. I think a statement was made that people do not understand the reforms as a positive change. And I think many people, Lily, myself, Priscilla, a lot of people are concerned about this emphasis on going after individuals when we have seen that there is a lot more money to be saved if you get some assessments of the contractors and providers for different projects for the county. This does not hurt individuals. This stops wasteful spending. And we've had examples of that with the prescription drug purchases by the county that were reduced significantly in cost because somebody bothered to look into the system that was operating and get those costs down.
That was Cindy that bothered.
That savings is ongoing. that's not just something where we got one person who was maybe misusing $1,000 or $10,000 of fraud. All those savings on the lower cost for drugs will go on until a contract ends, and then hopefully it will be renewed at the lower amounts. The same thing with the cost for the jail that we now have to build. We've had an offer of a significantly lower cost for the jail building, and that's just been languishing. There's been opposition to it. There's just this entrenchment to keep the status quo of the deals that have been worked out, regardless of the showing of the cost savings. So I think Priscilla's point is, don't penalize the vulnerable population. They're an easy mark. They've got the onus of, oh, those welfare cheats. If you look into the number of people that are cheating in welfare, it is a very small percentage. It's not this massive invasion of, oh goody, let's go out and use the food stamps to buy a Mercedes-Benz. This is a situation that can easily be corrected simply by pursuing the larger savings of overseeing what we're spending our money on and getting the best bang for the buck. And I have to thank Nancy Buck for confirming that she will continue some of that investigatory policy that IRA had employed to make sure that the county is not spending money that they don't need to spend to get the good or better services for the people.
Thank you, Priscilla. I agree. I just want
That's
to
Star.
Star, I'm sorry.
That's all right, he sometimes.
I want to urge my colleagues, we are going to be approving contracts coming up, many, many contracts, and I would like to review, maybe RFP some of them, but that's a discussion for a later date. Any other public comment? I think Ken had his hand up first.
This goes back to a couple of years ago and bringing it forward now, and with the fact that we have nobody in our motel system, we're finding apartments for them and so forth, which is a wonderful idea. Is at one time, DFS used to go and inspect, had somebody on staff who went and inspected the housing to make sure it was up to par, and I think we lost that along the way because he retired.
We're working on it.
This is public comment, not debate.
Yes.
Okay, and I like to know where we're going forward with this, because to me, Section 8 housing is the floor, is the best housing you can get, and anybody gets that has decent housing because they gotta meet certain criteria. And as long as we're paying public dollars for housing people, they should be living comfortably and properly, and that we should be doing this. And I think that one of the ways we can address this problem is we develop MOUs with individual town inspectors to be our inspection force and maybe pay them a stipend to do it. Thank you.
Thank you, Ken. Sandy?
I've been involved in several labor management meetings, and there's a lot of things that were said here today that were slightly misrepresented, and I think that the legislature should know about that.
I do too.
First and
Again,
foremost,
public comment, not debate. I know you're not talking.
there are a lot of staff. This is the first time that I have ever heard anyone say anything positive about the staff in that building. That's a problem.
I've said it.
That's a problem. There have been if you can ask any fraud investigator, whether it's the newly hired group from the DA's office or someone who's been there for 20 years, the largest part of the complaints that they handle are agency error. Agency error, not fraud. That is still not being addressed. In April, the agency learned how significant their agency error was. To date, they're telling you they're still setting up meetings, they're trying to set up trainings. Why is it taking this long? There are cases where we sat in a labor management meeting and were informed that 2 untrained workers were put into food stamp caseloads of 1,000. 1,000. You're saying that 32 out of 33 food stamp cases had the same error. You had 2 people untrained in a caseload of 1,000. There was a person on vacation and pictures were sent to the union of her desk, which had applications from August. There is a 30-day requirement if someone submits for food stamps to determine if they're eligible and get them help. She was on vacation in November. The applications were on her desk since August, not touched. There is a significant problem with staffing. There is a significant problem because for years the county cut out mid-level supervision. You used to have departments that are now condensed that one person oversees 3 departments, and they now have one person under them. It's no longer a branch, it's a solid trunk of a tree. That is a significant problem. The staffing is an issue, but there are a whole lot of other problems that exist. The welfare to work, I would urge Giselle to come to the WIB board meeting at 8 o'clock next week, I believe it's on the 9th, and hear what the employers in Sullivan County are saying are the problem with the workforce coming in, and work with BOCES. BOCES is it takes place at BOCES. BOCES is at every one of those meetings. A lot of the problem is a work ethic and job readiness, and this would help tremendously in that area. I think it's a huge plus, and I'm actually, you know, the union's gonna have issues with people having to relocate their job. That's, you know, a change in terms and conditions of people who were employed and hired into Monticello, and we'll address that. I don't necessarily, as a whole, disagree that it should be the person who comes in the door should be able to get every service that the county provides in one location. I don't disagree with that. But there are some concerns for the employees who will now have increased cost and increased travel time. I think the fact that each one of these meetings, I hear from Office for the Aging at the very end, they get this much. The Adult Care Center gets a little bit more, and the bulk of this revolves around DFS. Public health, same thing, little bit, yet we're the very worst, one of the very worst cases for health in the county, in the state. I think the focus here, you've done what you need to do to get a team in place for fraud, waste, and abuse. I think the focus has to, there's a lot more to it. There's just so much more to it. We know for a fact there's so much revenue out there to capture for youth development. We talk about the level of crime. Address it here. There is so much more out there, and the focus has to be broadened. I'm not by any way discrediting anything that has happened over there. I 100% believe that the amount of arrests show that there was a significant problem, but now that you know that that problem is being addressed, address the other things. Move the focus, look at the problems that are underneath that have created it. And that involves lack of training, lack of follow through. You talked about this housing person that I believe was removed from the budget. I have had several reports that I know I have brought to several legislators on some of the conditions that we are sending these people in. One involved a child with a health condition that was in a house that was condemned by the building inspector due to feces of rats. Okay? This housing inspector position is huge. It is impossible to not have that in place. And there are so many things that we are required to do in order to keep the state funding and federal funding that if these people had any idea weren't being done, you know, the county would be at risk for being sanctioned at a federal and state level and all money coming in to stop. People need to pay attention to what's really going on. And it's not just when people walk in the door stopping them from getting benefits. There was the training that they're talking about going to for employment, that's a huge aspect because the employment numbers are atrocious. And there is a huge gap, and there was a huge lack of job development. Every employer in Sullivan County will tell you that there's not qualified people, and that's why businesses don't come here. We don't have the right sort of people. We're not drawing in the right thing. But one of the things we're doing is we're getting people GEDs and we're sending them through the CNA program when they're not able to take care of themselves. And now you're expecting them to take care of somebody else. And guess what happens? Then they become my problem and Shanoy's problem. There is a complete disconnect on what needs to happen in Sullivan County in this area. And somebody needs to really sit down and put all these department heads in a room together and say, what can we do from youth all the way to senior, all the way through, and see what we can do to effectually change all of it, because you're changing bits and pieces and there's fallout everywhere else, and you really got to look at the big picture. Thank you.
If I may, just a quick statement, Gladys Walker. And I'm not gonna debate it, but I did learn a long time ago, never tell another person how to do their job. So I'm not here to tell anybody what to do. What I would really hope is that whenever there's a public announcement of any kind of efficiency report as it relates to people who are cheating, that will send them, take the opportunity to take a message to those that are vulnerable and let them know that this in no way prohibits you from coming forward if you think you need help. And I think we got victims in that percentage also. If we do that, and I say we because we really are in it together, if we do that, at least we're reinforcing that we're doing what we have to do. This is a temporary program, and we're asking you to tell the truth. And this in no way implies that we don't want to help people that really need it. Thank you.
Absolutely, thank you. Okay, Alan?
Just to comment on the housing component of it, I do believe we really need to expedite the housing inspection portion of it. And I do think that should be a county employee. While there may be some cost savings delegating to a town code enforcement person, I think the problem with that is it's gonna be on their back burner. It needs to be someone that's held accountable by the county, where we would be paying for the service, and I think the inspector should be, a county person.
Right, we'll continue that discussion at 11, okay. Motion to adjourn?
So moved.
Thank you.